I'm giving myself goosebumps. Their results were phenomenal. They were saying things like, I had no meaning and purpose before I started this. I just felt like, I didn't really have much of a reason to get up in the morning. And now, like, I am full of meaning and purpose. I know exactly what I'm doing. Like, I have my life back. And so to me, that's just astounding. And it tells me that there's something extremely powerful about something really powerful about the ketogenic phase.
You're listening to the Family Health Lab. Healthy parents, healthy kids.
Hello, Erin. Thank you for joining me. It's lovely to have you on.
Yeah, it's just an absolute pleasure to be here. So nice.
And tell me where you are and where do you normally work from?
Yeah, so actually right now, because it's August, I am in Spain, on the east coast of Spain. So I'm enjoying some sunshine, which is nice and well needed, I think, after the quite miserable winter and spring we had in the UK. And so I'm working from here for a few months and then I'll be back in the UK and working from there. And so just kind of going between the two at the moment, which is stressful with the traveling, but overall, I can't complain. It's a really, really nice setup. Not as nice as being in Australia, though, perhaps.
Yeah.
And having the sea both behind you and not too far away from you as well.
Yes, it is. It's we are really, really lucky. But I like that setup. I think it sounds like it's worth the effort there. There's Spain and London. So would you normally see clients, inpatients? I think you normally see in London. Is that the area you work from?
Yeah, exactly. So when I'm working and seeing clients, I see people when I'm based in London, but I work with people on Zoom. So I see everybody over the internet, and so I can work with anybody wherever they're based. I'm just predominantly based in London when I do that. And that's a really good setup for me, because it means that people, and we're going to get into it today, but it means that people who maybe can't access metabolic therapies, near them or with people who like face to face, they can still access it online with me, even if we're in different countries, as long as we speak the same language. My Spanish is not good enough yet to do it in Spanish, but as long as English is the language, then I can still help people, which is fantastic.
It is fantastic. And you help people of all stages of mental ill health and recovery.
Just like you mentioned, as people from kind of all levels of mental health diagnosis, but then also people who don't even have a mental health diagnosis, people who are feeling unwell, they're not feeling right, they know something's awry. Maybe they have low mood, brain fog, these things that actually often we just get on with and think it's part of life, but isn't. Dealing with a lot of those underlying symptoms, maybe some weight gain and fatigue. So I'll work with them to kind of implement some metabolic therapies for the hope of improving that and improving those symptoms. But then all the way up to people who have really severe mental health conditions, maybe a combination diagnosis of something like schizophrenia or bipolar disorder, which I think are becoming kind of, unfortunately, more household terms now, and even up to people who might be in a residential hospital perhaps and working with their family to help that individual implement ketogenic therapies with the help of improving their symptoms. So really quite a wide range of people with, severe mental health concerns, down to people who are just struggling with the day-to-day that might not have a diagnosis yet. So it really quite varies.
What kind of changes have you seen in the time that you've been both studying this, working in this, and you've researched to a great depth as well? So have you seen much change in the presentation or the rates of mental ill health?
Definitely. And so, I've definitely seen a change, whether that's just because I've been in it longer, I don't know, or maybe, now I'm working with lots of different types of people from different backgrounds and so on. But, when I was doing my undergraduate degree in psychology, back in 2008, 2009, and then doing my master's and so on, what we were learning about and the people we were working with was, people who had specific diagnosis. They were presenting as really quite unwell. notably unwell when you met them, and there was very little else. There were not many people who had mild symptoms. It was always quite severe symptoms that they had with these diagnoses. Whereas now, many, many years later, yes, I'm working with those people, but also there are a lot of people that perhaps were always there, or maybe it's something to do with the wider environment, but there are people now who, there's a higher rate diagnosis of ADHD, which I know we're going to get into. And then there's also, a lot more anxiety. A lot of people coming to me with anxiety as their main concern. A lot of anxiety around food, a lot of kind of eating disorders that maybe were coming to me at a higher rate than they used to. So I do think that more people now are coming to me with symptoms or are coming to me with a diagnosis. And the reasons for that, I think, are mixed. We could probably sit here all day and kind of have a guess as to why there are more. But it does seem to be that way. Like, I don't think these days, or I think these days it would be quite normal to say to somebody, like, do you know somebody with a mental health concern, or do you know somebody who struggles with their mental health? And they would either say, yes, that's me, or yeah, like my brother or my sister or my uncle or something. Whereas, 10 years ago, yes, maybe we didn't talk about it as much, but also I don't think there were as many people then that would say, oh yeah, I do know somebody. What do you think?
I think that's really interesting, and it's probably twofold as well. But definitely people talking about mental health more. I think years ago, don't you, if you remember, but people used to say things like people were bad with their nerves, and there were cases in my own family and neighbours who all you would hear would be kind of a brush off and then brushed under the carpet. You wouldn't really get into what that situation was. Did it look like anxiety? Was it that they were depressed? You didn't really get an idea of what that meant. I don't think it was talked as openly, but certainly I think with the pressures. I mean, I've got 2 teenage children, and just going through the school system, it's just so prevalent. The school psychiatrists, the school counsellors in the different schools, and I work in different schools as well on the nutrition side. So I hear again and again how completely overwhelmed they feel in being able to support, and how under-resourced they are in terms of supporting the young people coming through. And I do feel that's a change. I mean, it's a feel, like you're saying, but we know diagnoses are going up as well, and they're going up in young people. So yeah, I mean, it's a big area. I mean, and we're going to go into the key topic that we're wanting to discuss, which is metabolic psychiatry. It's now called, but really using specific nutritional therapies to support people. But I'm interested in just backtracking slightly in how you got into that. And I believe it was because you benefited yourself from changing your own diet with Ketogenic Diet, and for the reasons a lot of people do that, for your own health and your own weight, and felt better. And then you wanted that for your patients, for their potentially for their mental health, but also for their physical health. And it's just a point that I think is really important about what you are seeing with physical health in your clients, in that kind of population, and what are the likelihood of people who have mental health becoming overweight, for example, or even obese, or getting diabetes. Just thought we could touch on that.
Yeah, absolutely. So you're quite right. The reason that I went into it is I was always interested in nutrition, even through my psychology background and my education and training. My thesis or my project at the end of each degree was always in eating disorders. So that's what I did in my spare time. I was a bit of a geek, and I just used to nerd out on diets and things like that. Mm-hmm. And yeah, I came across the low carb diet, did it for myself, felt really good, and then thought, I'm going to research this a little bit more. And that was just at the time, 2014, 15, when there was research coming out about low carbohydrate diets and type 2 diabetes, and being able to regulate blood sugars, reduce insulin, and pretty much help to kind of put this disease somewhat into remission, or totally into remission for some people. And so, you know, when I looked at the people that I was working with at the time, so these are people in an inpatient unit. So, you know, they are there for maybe 2 weeks, 6 months, maybe even a couple of years on a ward, eating hospital food, you know, being cared for in the hospital environment and taking medications and so on. Almost all of them were either had type 2 diabetes or had pre-diabetes. You know, we'd be checking their blood sugars once a week as part of our routine, and their blood sugar levels were skyrocketing, so much so that sometimes even on the meter, they wouldn't even have a reading. It would just say high. And this is before breakfast. This is before medication. This is before, you know, a cup of tea with 5 sugars in it, because sugar, you know, you could have as many sugars as you wanted. And so I just thought at that point, well, you know, this diet, if we could just at least start to maybe remove the sugar, because these people are putting 5 or 6 sugars into their coffee to offset the effects of their medication, which is making them feel really groggy and sluggish. If we can maybe swap that out for something else, or just reduce the amount that's there, maybe that can just help to, you know, bring their blood sugar levels down. That was before I even started thinking about like the mental health benefits that it might have. I was thinking purely from a physical health basis, because, you know, I'm sure, you know, maybe your listeners don't, but some of the medications that people who have a diagnosis of a mental health condition have to take, they can damage our metabolism. In other words, they can get in the way of how our body converts food and things into energy. They can get in the way of how our brain function. In some cases, they are specifically taken to alter how our brain works. But some of them, not all of them, some of them can have negative impacts on our metabolism. And often what we find is that people will then start to gain weight while taking this medication, or taking a combination of medications. And then when you put that alongside the fact that they're on an inpatient ward, they're not getting much exercise, they're getting very little daylight, you know, they're eating 3 structured meals a day, and sometimes the only kind of pleasure that they might get in the day would be from getting a takeaway on top of that, dropped off to the ward. You can see how this could escalate very quickly and make it very difficult to kind of turn the ship around. And so that's when I really realized that there was a big problem. And then when I started kind of digging into the research a little bit more, and I came across how the low carbohydrate, or specifically ketogenic diet, so even lower in carbohydrates, how that could actually possibly improve mental health symptoms. So specifically like hallucinations, delusions that are quite specific for some mental health conditions. I thought, wow, we need to go do some more research on this, which is what I then did. I went and did my PhD specifically on the ketogenic diet and depression. But very simply, that's what I was seeing on the physical health level, is the fact that that setup, though it's inpatient, that's not for everyone, but that setup and the medications and that the lifestyle that they had was just not helping them in any way, shape or form on a physical health level. Maybe on a mental health level, but not physically. So I knew that there had to be an intervention there of some sort. And I think low carb would be that, yeah.
Yeah, I think talking to others in the field, Dr. Stoltenstein and I, we've discussed that issue. That, I mean, it's a huge issue that people are, you know, made to be unwell because of the medication. But the medication has been a major breakthrough in supporting people to take their symptoms down. So it is now looking at the next wave of what could be used alongside medications, or what could be used as a therapy instead of medications. So, and that's what you've mentioned your research, and I'd love to talk to you about your journey through your research, and that was focused around specifically around patients with depression and looking at controls of people who didn't have depression. So yeah, if you wouldn't mind talking me through that sounds really, really exciting. It took you a very, very long time, I understand, as well. So you really dived deeply into it.
Yeah, it did. It took me, I'm a very optimistic person, and I thought, I'll do this PhD part-time, but I'll go at a full-time pace and I'll have it done in three years alongside my full-time extra hour NHS inpatient psychiatric unit work and have a life at the same time. I was bananas. I was totally wrong.
Love the optimism though. Love it.
Yeah, I tried. And then you could just like throw in a pandemic then towards the end as well. But you know what? I made it out the other end, so that's good. So back in 2016, once I got really excited about the potential that this could have, there wasn't really any, apart from a couple of papers, from early in the 60s, there wasn't really any solid research for me to hang my hat on to say that, yes, this keto or low carb diet could help.
And that research in the 60s, that's what piqued your interest, because it was game-changing type results, the type of results we don't see with other interventions. So that got you excited to look into this.
Exactly. So in brief, that study took a small group of women that were on an inpatient ward who had a diagnosis of schizophrenia, and they put these women on a ketogenic diet. And what they noted, it was short, very short period, just a couple of weeks, but what they noticed is that their delusions and their hallucinations that, had plagued them for decades significantly reduced. Even though they were on standard treatment and that hadn't been doing anything, significantly reduced. And then when they added the standard diet back in and brought the carbohydrates up, their hallucinations and delusions came back. And that was the first pilot study, looking at the ketogenic diet and schizophrenia, groundbreaking study, but then nothing was done since then. It was never followed up. And I think this is because the advent or the invention and the addition of like antipsychotic medications and so on in the 70s. In fact, I'm a true researcher at heart. I went and I took the three authors of the paper and I searched the planet for them to see if I could follow up with them, to see like, why didn't you continue this research? And one had passed away, unfortunately, and the other one had moved into something different. And there is one remaining who actually I have a phone call booked with next week who I'll be speaking to. Yeah. He actually went off to become the president of Costa Rica, which is a bit bananas. Yeah, I know, it's very strange, but he was a psychiatrist, back a long time ago. So I'll be speaking with him soon, and hopefully I'll have an answer as to why he didn't follow it up. Anyway, So going back to the research, what I did was I took a large group of people and I split them into controls. So I just asked them to continue their diet as normal. And then I took a group who were going to do a low carbohydrate diet. So not very low carb, just like 90 to 130 grams low carb. And then a group who were going to do a ketogenic diet, so much lower carbohydrates. And each of those groups were split into two. There was a group of people within each of those that were healthy, who didn't have depressive symptoms, and then people who did have depressive symptoms. And tracked them over 12 weeks initially with each of those diets. And then they went off and did it on their own. And I kind of left them to it to see if they were going to continue or if they were going to drop off. And then I checked in with them at the end of 6 months. And, there were a couple of limitations, I think, to the research, which that's how it goes when you do research. Some limitations maybe to the design of the project, because the diet implementation was remote care. And what that means is it was on an app with some educational videos and so on. It didn't have chat bots or like people to talk to you on a chat. That didn't exist back then. Like if we think way before Zoom and way before video call, like that didn't exist. So there wasn't much personal contact, which I think actually is fundamental now. But it didn't have that. So there was quite a high dropout. But what I did see is that people who followed a low carbohydrate diet, so not ketogenic, but low carbohydrate, they saw improvements in their mental health and their psychological well-being. Mm-hmm. So it's a really good reminder that you don't always have to go all the way down to a ketogenic level to see improvements in your mental health. Just small changes can make the difference. But then also, when I spoke to the people who did do the ketogenic diet and who stayed on it for the duration, this is the paper that I just published recently. There, I'm giving myself goosebumps. Their results were phenomenal. You know, they were saying things like, I had no meaning and purpose before I started this. I just felt like, you know, I didn't really have much of a reason to get up in the morning. And now, like, I am full of meaning and purpose. I know exactly what I'm doing. Like, I have my life back. And so to me, that's just astounding. And it tells me that there's something extremely powerful about something really powerful about the ketogenic phase, which there is, that can be very helpful for some people too. So overall, it was quite a positive experience. And I'm in the process of getting the rest of it published. It just takes a little bit longer.
Yeah, that's wonderful. The different elements to that people who are adjusting their diet and reducing their carbohydrates are seeing positive results. And I mean, I would echo that. I've seen that with children I work with different clients, just going into low carb or even just clearing up the diet, seeing really good results. But yes, there's something particularly special about getting yourself into a ketosis diet. So what is the next phase that you're publishing of that research?
Mm-hmm. Yeah, so the first stage was publishing the experience of those people doing the ketogenic diet. And the reason why I chose that first is, up until now, there hadn't been any what we call qualitative data. So we had not lots of, but starting to get lots of numbers and pilot studies like, you know, this can improve things by X%. But we hadn't actually had any research to tell us what people said about their experience, like what was their experience in their words. So, you know, if Sarah from Solihull in England, you know, has her experience, and then James from West Virginia has his experience, like, it was, how do we actually get all those voices to come together and share that, because it's different. So that was the first stage. The next stage is going to be publishing the actual randomized controlled trial. And I'm trying to figure out the best way to do that. I think there's a lot of learnings. And one of the main learnings there was the fact that having somebody to kind of keep you accountable, somebody that really knows what they're doing and ideally has a lot of experience with this, is key. Because one, it means there's less room for error. But two, it also just gives you a little bit of confidence knowing that you're going the right direction and you're not spending 6 months doing one thing and maybe even kind of setting yourself up for worse symptoms. So that will be the next thing I'll put together, which will be that trial showing the pros and the cons of it and, you know, really pushing the accountability side. And then I think there will be another one from that, which will be around looking specifically at the low carbohydrate approach and like how far did people improve, and then, you know, did it take them so far and then there's still more room for improvement whereby they could have moved into a ketogenic approach, or was that enough for them? And so that will probably be the third piece that I will do. But, you know, just kind of going back to what you were saying off my explanation, was that low carb will definitely, you will see improvements, but then often if there's still things that are lingering, that's when you want to make that move into ketosis for a period of time and see if things improve there.
Which is why that study sounds so powerful, that you did the 3 different levels of diet to show the different stages. And the even learning from the dropout, I think that's part of this wave of learning about these types of nutritional therapies, to know how we can best implement them. And absolutely, I think because they're so specific, more direct support sounds like a really, really good option. I think and it's really, really important for people. So I know, I think those results are phenomenal, particularly in light of we're not really having other breakthroughs. And this is food. So if I look now and do a quick search and look up in the UK, the biggest mental health charities or the US ones, I will get, and I talk about food, I'll get kind of a little bit of nuanced answers, nothing very, very direct or clear, but often they point to specific foods. So eat more oily fish, have some more salmon, and definitely have whole wheat pasta. Try to avoid white rice and go for your brown rice. Pulses, legumes, lots of fruits and vegetables. What are your thoughts on the current advice, and how does that fit with your trial that you did?
Mm-hmm. Yeah. So most of the advice is focused on the kind of like the dietary guidelines that we have now. And if anything, the most experimental, I think Google or these large companies will be telling you to follow maybe a Mediterranean style diet, which still includes, some whole grains and alcohol and red wine and these things. And so that's quite different to a low carbohydrate and ketogenic diet that I used in the trial and what I do with my clients. And, really what we're doing is turning the dietary guidelines on their head and really focusing on, I like to focus on what you can have rather than what you can't, but it's a transition. But, really focusing on, fats and proteins, because both fats and proteins are essential for life, whereas carbohydrates theoretically are not essential. They just give us energy. Yes, there's some nuance there, but generally speaking, fats and proteins are what we need. And so I focus, and I did this in the trial too, is the focus is around fats and proteins, and then small amounts of carbohydrates that are low sugar. So things like green leafy vegetables, avocados, olives, these types of things, which is very different to what the dietary guidelines suggest. But at the same time, it does seem to help people feel better, and even things like after a week or two of doing that, the hunger and cravings that you have for anything, brownies, ice cream, pizza, chocolate, that disappears. That voice that, often quite a lot of people are plagued with, even if they don't realize that voice that they have in their head, compelling them to eat certain things or get certain foods, that quietens down, and hunger reduces, which makes it very easy to lose weight without having to, be pining after, a meal every 3 hours. Mm-hmm. And so there's something a lot more powerful about eating this way. And it's because most of the time you are putting yourself into a state of ketosis, which I'm sure we will get into, but you're putting yourself into a state of ketosis, which simply means that your blood sugar levels have come down and have regulated. You don't have many carbohydrates to give you energy. So you're moving your body over to using fat as energy. And when you do this, you create these little molecules in your liver called ketones. And these ketones they're like little golden nuggets, right? They have so many benefits and they work in so many different ways. And once you start to create these ketones are what gives you appetite suppression. It's what's anti-inflammatory. It's what reduces anxiety. So having the production of those, that's what you get from following that kind of diet, which you don't get if you follow the standard dietary guidelines or if you follow a Mediterranean diet, because it's still too high in carbohydrates and sugar and alcohol and such. So that's the difference there between the two.
Beautifully explained. I've never heard of ketones being called golden nuggets. I love it. I think that's really, because it's visual, but it's it's just shows a little visual of how powerful and positive force that they can be for your body. And people have come to learn about ketogenic diets, ketosis for weight loss, the vast majority of people, and which is great in itself. But now what you and your colleagues around the world are discovering is what you're saying, those type of dramatic changes in people, that they can feel purpose again. And they talked, I think, in your research also about having higher self-esteem and feeling motivated in the day and having confidence. I mean, that's a wonderful thing for you. It must feel very, very uplifting. That comment you made about how you embed the food changes with your clients online often, and that you like to focus on what they can have. So you're adding in, I think that's my approach when I'm with my nutrition clients. I really like to focus on the positives, because the food is so positive. I mean, it's really tasty. It's often the things that we've been warned away from years ago, but the nutrition advice is changing, and back onto eggs, and we're talking often about meats and seafood and eggs and nuts and cheese and things that are really, really satiating, but also potentially can help the body to get into that really important ketosis state. We've mentioned metabolic psychiatry a couple of times, so shall we go there? And I mean, that's exactly what your study's been all about, and it's exactly what your work and your specialising is. As a ketogenic practitioner and a metabolic health practitioner, supporting people with their mental health challenges, or just who want to feel better and more energized. So can you break that term down? It's probably a bit of a difficult term for people, metabolic psychiatry.
Yeah, I think it still probably feels quite abstract for people, because the word metabolic is kind of new to people. And then psychiatry, you think of psychiatrist and medication, and maybe you just think about bipolar disorder and schizophrenia, and less so about anxiety and things like this. So, metabolic psychiatry, it was actually coined by Dr. Shabani Sethi, who's a psychiatrist in the US. And she is an obesity specialist and a psychiatrist. And so through her research, she was able to kind of bring this term into light. So metabolic psychiatry, where you are essentially able to improve people's mental health symptoms by improving metabolism. So you improve metabolism through metabolic therapies. So metabolism is all about, how we get energy from food and how we can kind of like build and repair with food. And so we can use metabolic therapies to improve our metabolism, because there's some research to show now, and actually more and more coming through, that a lot of the root causes of mental health conditions can go all the way back to metabolism and to there being a damaged metabolism. If we think about the work of Dr. Christopher Palmer and his great book, Brain Energy, that maybe some of your listeners have read, he talks a lot about the cells in our body, and then the engines of those cells, the mitochondria, and how when we have an upset or damaged or sick metabolism, those mitochondria and cells are sick. And therefore, if they're unhealthy and sick or sad, that's then going to have a knock-on effect with our mental health. And then it's going to produce negative mental health symptoms, which can then go on to develop into a mental health condition. And so if we stick with the idea that, a lot of the root causes of mental health conditions, even including things like trauma, can have an effect at the cellular level on metabolism, then we can use metabolic therapies to help improve our metabolic health, or our metabolism health, the health of our metabolism, which can then help to improve our symptoms, the mental health symptoms that we're dealing with. And right now it is early days in that, we can use metabolic therapies to help improve symptoms. For some people, that's all they need. For some people, it simply helps them to access therapies more so. Perhaps they have more energy. By fixing their metabolism, they're able to be more energized and motivated to access talk therapy or to access CBT, which can then also help them to improve their symptoms. And then for other people, it might be that you use metabolic therapies alongside standard care. So alongside the medications that you're taking, whether it be an antidepressant or an antipsychotic, and that can help. They can work in tandem together. And then even sometimes the ketogenic diet in some cases has even shown to be so powerful that actually some people can reduce their medication with the support of their psychiatrist over a long period of time, and then still use the ketogenic diet as essentially their form of therapy. So there's kind of a lot of different endpoints. So not everybody's journey is the same, but that's what metabolic psychiatry is about. It's about using metabolic therapies to improve metabolism and metabolic health, with the end goal of improving mental health. And the way I like to look at it is, this is how I explain it to the people I work with. If we take a pyramid, and at the bottom is your metabolic health, is your foundation. Okay, and so metabolic, the first step we would take is to clean up the diet and maybe even move into a state of ketosis so that we can get some of those ketones, because once we've got those ketones around, they're going to go work their magic. So that's always the first step, because that's the base of the pyramid. And then there might be some improvements, but there's still going to be room for improvement. So then you move on to the next step, which is other metabolic therapies. So once the diet is under control and feeling calm and routine, you move on to other things like exercise and maybe a little bit of intermittent fasting, perhaps, if the person is suitable, or connection, or morning light, circadian rhythm, these other things that maybe, your listeners are familiar with. And then you've got your foundation and then these other metabolic therapies. And that combination, people can see a huge improvement in how they're feeling. And then you get to the top of the pyramid. And this is what I say to people is, if you've done the other two steps and you still have lingering symptoms, there's still something that's not right, you don't feel 100%, but you've done everything else, then that's when you would go and see a specialist in that area. So, if you still have gut issues, you might see a gut specialist. Or if you think there's some mold or, some of these heavy metals, these other things that people get quite stuck on, they can then go and see a specialist for that. Because sometimes I get people coming to me and saying, I have gut issues and mold issues and heavy metal issues. And I'm like, okay, yes, but your blood sugar is out of whack because you're eating a standard diet. Your vitamin D is through the floor and, you're not even leaving your house. Like, we have a lot to clean up on the bottom, sort the foundation out first, and then kind of move our way up.
Definitely get people asking those type of questions and wanting those kind of specific testing. But it's almost doing a disservice to somebody, in my opinion, if we go down a really niche route before we have sorted something as basic as nutrient-rich foods, for one, getting better quality foods and nutrients into you, but specifically getting your insulin, potentially insulin resistance, and your blood sugar under control, which we can do with food changes. And that takes a while to bed in, get that sustainable change in, and then we can move on, as you say, to other factors of health, because it's a whole health, like sleep, screen time, routine. Because I'm often now getting more and more people with neurodevelopment issues coming to see the benefits that you're talking about, the more control and more emotional regulation, better more stable mood. And so, so kind of steering people away from very, very niche specifics when we need to do the 80%, the low-hanging fruit, and stabilize things with a foundational approach. That's a really good way of explaining, and detailed way of explaining as well, and mentioning some of the key players who are developing this. This is becoming a new field, an emerging field, but those professors that you mentioned are pretty much leading the way on this, and yourself in the UK and some others. So I mentioned neurodevelopment, but also mental ill health conditions. You've mentioned a few, but this is a wide open. We're seeing benefits across different types of conditions. I'm just wondering, have you any specific case studies that you want to share of who you've supported in different areas?
Yeah, there are actually, I have a couple. The first one that I wanted to touch on is actually, it's an area that I think will be maybe last to come to the metabolic psychiatry table, perhaps because there's a lot of kind of other professionals and other treatments that kind of are all together in the area, which is the area of eating disorders. And so there is a little bit of research to show that a ketogenic diet can help with anorexia nervosa, with weight stable anorexia nervosa. There isn't anything yet with bulimia nervosa, but what I have been seeing, because I have a program specifically for people with binge eating and ultra processed food addiction. What I'm finding is, like, I have one individual, for example, who I've been working with for a couple of months now, who, you know, when they came to me, thought that they were a complete lost cause because they had been binging pretty much as long as they can remember, and they're in their 30s now, you know, binging from 4 or 5, some of their earliest memories on ultra processed foods, and had tried everything, you know, lost weight, gained weight, and so on, and was just plagued by this voice that just compelled them to go out and to get their binge foods. And I've been working with them for a couple of months, and it does seem that when they move into a state of ketosis and they have a certain range of ketones or a certain amount of those little ketone molecules, that voice that has completely plagued them gets very, very quiet, and it gives them a buffer. And I talk a lot about this with people, and maybe if people have listened to like other places where I've spoken online, I talk about this buffer space between whatever's happening outside and then your reaction to it, and being in a state of ketosis seems to give a little bit of buffer. And so this individual feels very calm, very in control, can follow, you know, a structured couple of meals per day, all ketogenic, doesn't feel restricted in any way, doesn't feel compelled to go and binge in any way, shape, or form, doesn't feel that out of control feeling that often a lot of people with binge eating tendencies or food addiction do, and overall just feel so much better and feel that they can actually turn up in their life and show up as the best version of themselves, whereas before they could be sitting with their family and just not even be present because they're thinking about how they're going to go and binge. And so that research is not out yet. There's 1 or 2 papers alluding to ketogenic diets and binge eating disorder, and I know there's some other research being written up right now, but there's a lot more to be done. And I think that actually the ketogenic diet for that can be quite powerful. And this person I've only been working with for maybe 3 months now, and you know, such a huge improvement in 3 months compared to, you know, the 30 years previous. So that's the first one. The second one is for working with a young person. And this one is it's one of those ones where you kind of leave and you just feel really good, like you've made a difference. And it's a young person who has a diagnosis of schizoaffective disorder, which is kind of like a combination of all of the mood elements that you would get with a mental health condition, and then also some of the elements of schizophrenia where you might have like delusions and hallucinations. So it's really a full package, and it's very difficult for individuals to live with a condition like that. And this person is quite young. They're only in their early 20s, and they had kind of dropped out of university and everything because they didn't know they couldn't manage it. And after, you know, this person has been extremely compliant with the ketogenic diet specifically and have quite high levels of ketones. And, you know, 3 months down the line, that person's now going to be going back to university next month. And they are starting to reduce their medication with the support of their psychiatrist.
Oh, wow.
And they're using that ketogenic diet. Oh, gave myself goosebumps again. They're using the ketogenic diet to kind of help be their foundation and be their buffer. And so even if it means they go back to university on a reduced level of medication and still some medication, they've still got the power of the ketogenic diet. They've got the power of, they've implemented exercise, movement, morning light, these other metabolic therapies too. And they're just overall doing so much better. And for somebody so young who has their whole life ahead of them, who has essentially been told you need to be on this medication forever, and you're 20, to dropping out of university to now within a year being able to go back again and give that another go, is essentially like you're being given back your life again, even though there's still some medication there, fine, but you're holding yourself up with this metabolic therapy. And I think the reason why that hits home so much is like a lot of your listeners, or even yourself, like you have teenagers. And so that could be your teenager, or that could be your young child. And 20 is so young. And for them to have had such bad news, but then to be able to change things around is really quite extraordinary.
It is extraordinary. And particularly if they're already on medication, and this has given additional, life-changing benefits by the sound of it. They're really powerful testimonies. No wonder you're so proud of both of those cases, working with those individuals. It's, this is why you do this work, isn't it? This, once you hear about this, and in your case, when you read about it, got excited and then couldn't find any more information. So you started your own research, and then got the training and moved over into offering this support. And now you deliver training, I believe, on this as well, so that we get it more people in the field. So, and just on that point of more people in the field, which is what we desperately need, because you're right, this could be, our children, it could be our children's friends, and it is in some cases people listening, and we're more and more of us seem to be affected. So how many people are offering this type of support? I know that we're thin on the ground, really, at the moment.
It is a bit thin on the ground. In the United States, it's a lot more, I'm going to say a lot more accepted, but I mean, we're still very niche and fringe. In the US, it is more accepted. There are quite a lot of clinicians in the US that can provide this kind of at different levels. So, for example, people can go to Dr. Georgie Eads directory, which I'm sure you might put in the show notes. There's a clinical directory there where you can go and you can find somebody who has these expertise to be able to help. And so in the US, there are some people that have been doing it for, a good couple of years now. And then Dr. Georgia Eid herself has a training program, and some people have been doing that. And then they go on the directory. So they've been doing it for a little less time, but they have the training they need to be able to work with individuals.
And you've done that particular training course, haven't you? I've done that as well. It's an excellent course. It goes into great detail and lots of really important areas, including medication interactions, which is an important part of it. But yeah, great course.
Absolutely. And even for people who just want to learn more about it, it's a really, really fantastic course in that respect. And then over in Europe, then, in the UK, I think I know Ali Houston, who some of your listeners might be familiar with. He has MetSci, which has a community, I think, where they have book clubs and things like that. And Dr. Rachel Brown is a psychiatrist in Scotland who I think has a small private practice and works in the NHS. And then there's me based in the UK, but I can see people internationally, as I said. So other than that, then I think there may be a couple of people, but more so researchers kind of scattered across Europe. Yeah. These are the researchers that are really digging deep into the mechanisms of how this works. So I really feel like, I always had a hunch that this would work, but I had to test it out with the research. And then when the research looked like it was positive, and I emerged from my PhD, and this was at the same time that metabolic psychiatry, the field, was just starting up, then, it's kind of like I've been waiting for 10 years for this. Like I knew what I wanted to do, and that was to help people as best I could, and to make the care as accessible as possible. But then also, I can only see so many people. So I see people one-to-one. Now I run groups. My next group is starting September 9th, if anybody's interested. But I run groups so I can see more people and people can learn and do it together and they have the support and accountability. That's great. But I can't see the millions of people that, have mental health diagnosis or don't even have reached that threshold but don't feel great. And so the next step then is to train people. And so what I do right now is I run like a monthly webinar to educate people on the science as to how it works. And in September and October, I'll be launching a non-prescribers clinical program. So this is for people who don't want to implement it with their clients. They might be psychologists or social workers, but they want to understand more about how it works and they want to be able to support their patients if their patients are doing it. In other words, they're not going to get in the way. They'll say, yes, I understand the research. I know what to look out for. I can point you in the right direction and I will support you through and through to use this as a adjunct to your standard care.
Wonderful. That sounds
program. Yeah, then the clinical program will come in October time, which is more so, how do we do this? So similar to what Dr. Georgie offers, but mine's kind of tailored a little bit differently, really focusing on making that lifestyle change, because there are lots of lifestyle obstacles that people face that have worked with people long enough to try and help them through those. So that will be the clinical program that will come in October. So if people are able to, if they're a metabolic health practitioner or if they're a nutritionist and they want to be able to do this and they have kind of a society to support them, then that program would be for them so that they can then go and have their own practice and they can work with their own people and reach more people overall. So then everybody has access to it.
In terms of who this nutritional therapy might help, it doesn't help everybody. I mean, your research showed a dropout rate, so people were not able to adhere to the diet. Perhaps a big part of that we'll find out in the future is because of that additional level of handholding that people need, and particularly when they're struggling with other issues and their mental health or the depression in that case. But also some people don't see any benefits. So just a comment on who it's most useful for.
Yeah. And I think this is really, really important because a lot of people, when they come to me, they have read these incredible stories about how people have changed their life in a matter of short weeks and all their symptoms have gone away and their life is daisies and roses. And I have to set expectations and say, listen, yes, that can happen. It can happen. It's been shown to happen. But it's probably likely a bell curve. So, those people are here and then we got this bell curve and then this is where nobody gets any benefits. And then you are going to fall anywhere in that range. Because otherwise people, by week 6, people are like, it's not working. Why is it not working? I'm like, hold on a second. Like, this is only 6 weeks in. We have so many more things to do and to tweak and to change. And it takes time to heal metabolism. It doesn't happen overnight. And so you're quite right. We don't yet know exactly who this works for and who it doesn't work for. What we can be sure about, because this is more helpful, what we can be sure about is we know that low carbohydrate diet, so cleaning up the diet, low carb and ketogenic diet will improve physical health. Like we know it's going to reduce risk of diabetes, heart disease, etc. All of those things. So bearing in mind that I think it's 8 or 12% of the US is metabolically healthy and everybody else is metabolically unhealthy, we could pretty much say that nearly everybody would benefit from a stint of a low carbohydrate or ketogenic diet to improve on the physical health level, which will then have a knock-on improvement to energy and motivation and less brain fog and things like that. So that's good. That's like the bare minimum. So that will happen. Then it's okay, who is going to respond? Who is going to have mental health symptom improvement? And that seems to vary. It seems to be that people who from my experience, people who are younger maybe see changes more quickly than people who are older, perhaps because older people maybe have many more years of metabolic damage, or maybe they're on a combination of medications or a combination of physical health concerns too. So it's a little bit more complex, but we don't fully know. And so when somebody comes to me and says, like, is this going to work for me? I can't promise them yes, but I will say it will improve your physical health, which will have a knock-on effect to your mental health. It may improve your mental health symptoms, and right now it's looking pretty positive and good from the people I'm working with and what my colleagues are doing too. And also, it's low risk. And what I mean by low risk is if you work with somebody who knows what they're doing, and you can implement this safely and effectively in a way that's cost effective for you, that you can also then turn into a lifestyle, so something you can do long-term sustainably, it's low risk. It's not taking a medication that you don't know what the side effects are, or they have funny side effects, and then you need another medication for that medication, and then maybe that brings on something else and you need something else to help you. Medication can be extremely effective in acute situations. It can be life-saving, right? But for short term. So this is why I say to people, it's worth giving it a shot, because you don't actually have so much to lose. In fact, I would say you almost have nothing to lose apart from the fact that you're going to lose your want for sweet things, which can't be terrible.
Yeah, there's so many benefits. And I mean, just as you were saying that, I was just thinking of the people who have come to me for a particular health condition around, say, diabetes or weight loss. And then they, by week 6, when we're discussing how they're feeling and the changes, and we're looking at how they're tracking that, and they're noticing that their anxiety has gone, but they hadn't noticed they had anxiety until the constant buzz in the background and the feelings of feeling under pressure, feeling stressed, feeling hyped up have once they've gone. It's like the chatter of food chatter and the food noise and the cravings once they've gone. But yet the number of people that have said, I didn't know I had low level underlying anxiety until it completely cleared up. And it was like a breath of fresh air, of clear thinking. So the potential for other knock-on benefits that are actually very, very important to your quality of life is a really good point. And also how low risk is in, like you've explained, that we don't, it's not like taking a pharma intervention. It's not heavy on any of the internal organs. The benefits, and people talked about side effects of ketogenic diet, side effects of low carb. But when we hear again and again that, there can be minor ones initially that can be mitigated quite simply, particularly with support. And then mostly it's very, very positive, as your research showed. Just on the food being a central theme to this whole conversation, but also this new wave of mental health and potentially neurological and potentially neurodiversity treatments and support. You mentioned Dr. Chris Palmer. He has put forward the fact that he believes food is one of the biggest factors that underline, that potentially causative to autism and ADHD, those type of conditions, but certainly mental ill health. What are your thoughts on those topics?
I do agree. I haven't specialized in those two specifically, but even prior to my research, there was a lot of work and a lot of research done around the removal of gluten and casein, so wheat and dairy products, to help people who have autism. And so with a ketogenic diet, and especially a therapeutic or a medical ketogenic diet, you are removing both of those. And so some people do seem to see improvements by removing those. But then also people with autism specifically seem, not all of them, but some of them do see improvements when they have higher levels of ketones. So there's a dietitian in the US, you might be familiar with her, Beth Zubek-Kania, and she has been working for many years, and Denise Potter been working for many years with children who have autism to implement a ketogenic diet with very good success. And so I definitely think, if people are struggling or they don't really know what to do next, it's worth considering that or speaking with somebody who can kind of consult on that. With ADHD, in the beginning, I didn't really know how to approach it. Right now, Dr. Ali Houston, who will soon be Dr. Ali Houston once he's got his PhD, he's going to be doing his PhD in Oxford, looking specifically at ADHD and the ketogenic diet, because right now there isn't any research yet on it. There's only some research in dogs and animals, which is not us. And so I didn't really know how to approach it, but I had somebody who came to me and they said, listen, I want to lose a little bit of weight, but also I do have ADHD. But they were very sensitive to the medication. So they didn't like taking the medication because it was too much for them, even though it would be quite effective. And what was phenomenal to me was once they got into ketosis and they had these ketones, they were able to get the ketones up to a range. And then they said that when my ketones are in this range, I mean, this is not news to me, but it was news to them. I can concentrate better. I have more focus. I can sit still. I can do the things I want to do. I can complete projects and tasks, which previously I was not able to do at all. And I just feel very calm. And so he essentially said that ketosis for him was almost like a low dose of his medication that he was unable to take. It was giving the same effects. And so actually what we did with that individual was continued them on that ketogenic diet. So they had that kind of low dose effect. And then if they had a big project or if they had something that they really needed to focus for and they felt like they needed some extra ketones, there is actually something called exogenous ketones that you can drink. And these are not suitable for everyone in all circumstances, but for him at that time, he was able to take them and it gave his brain this extra energy that he needed to focus. And so he is able to use and manipulate the ketogenic diet and these exogenous ketones to manage his ADHD without needing medication. So that's one case study. It's also an adult, so it might be different for children, but it's very, very encouraging. And so I'm really excited to see the research that Ali Houston does to see what his results are, because I think there is something there.
Absolutely. I'm excited. I'm due to speak with Ali on this podcast, actually, in a little while, in a few weeks. And Beth I've had on, and we've talked about really cases of, she specialises in ketogenic diet, and she's got around 30 years expertise. Yeah. She's really one of the pioneers. So there's not a lot that she wouldn't know about this, but specialising in ketogenic diets for children with epilepsy. But now she's much broader in who she will support with ketogenic diet. But yet she has seen phenomenal results with autism, with improved symptoms, improved behaviours that have taken those down down the level that they're reported as on the autism scale. And she was saying that one child had come off and was no longer diagnosed with autism. But she was saying without fail, any child that she's treated, and she has treated many for epilepsy that also had autism, without fail, she has seen improvement. And that's so exciting. With ADHD, again, you introduced that saying that it's no surprise that somebody might see those changes in improvements in mood, attention, focus, emotional regulation, those type of, which are the absolute core of ADHD, how people present and what they struggle with. But we're seeing those improvements in other mental health and other just people who are doing this diet for metabolic health. So why wouldn't see it in ADHD? And in fact, I work with children who have ADHD, and I very much see really profound changes that make such a difference to the quality of life of the family. So yeah, it's exciting. I think that you know, more and more of this research is going to be so supportive to people. Just back to metabolic psychiatry. It's not only ketogenic diet. We're making clear, you like to make this clear, don't you, that ketogenic diet is the not everybody needs to get to that level. Is that your thinking on this?
Yeah, I think there are kind of two ways I look at it. Not everybody needs to get there. And I often start slowly with people. I don't just drop them in ketosis because it needs to be manageable and safe. And there are some initial risks for some diagnoses. So we clean up the diet first and see how low carb goes, and then see how the improvements are, and then move into ketosis if we think it's necessary, which often, you know, it is. But then at the same time, we also have to remember that this works because the ketones are produced, those little golden
nuggets.
Yes. And there are a couple of ways of producing those. And not everybody knows this. Everybody thinks that it's just the ketogenic diet that produces ketones, whereas actually there are other things like intermittent fasting that will produce ketones. Exercise, if you do it in a certain way, can help produce ketones. And so what I like to do is lower carb keto and then practice using these other tools, these other metabolic therapies, so that then that individual has different ways of keeping their ketones in the range that they want. Because there's going to be birthday cake that they're going to have to say no to, or they might get sidetracked, or they're in the airport and they don't know what to do because there's no food. Okay, if they don't know how to intermittently fast, it's going to be a struggle. So helping teach them so that they can practice these other metabolic therapies and implement them gives them more room for maneuver than lifelong if they're going to continue this indefinitely. Because really, as long as you have those ketones up in the range, and generally speaking, it's your internal production of ketones. Like I mentioned, there are exogenous ketones that you can drink. You can use those in very specific circumstances, but really you need to be making them yourself. So through your diet, through fasting, exercise, and some other things, once you're able to do that, as long as you've got those ketones in the range that you need them, how you group your metabolic therapies might look a little bit different to how somebody else groups them, if that makes sense.
Yeah. It does. It makes sense. And everybody is, you know, they're so different with a range of different, potentially mental health or metabolic health or combinations, and how long it's taken to develop those conditions and what the causes are, what the root cause is. And then as well, people have very particular, issues around food, but also cultural preferences, different ways of eating. So yes, it's all of this is going to be very, very tailored to people. So just to close, I'm just thinking of those people out there that might be listening and thinking, how would they get started? Do you have any tips, not potentially to go into full ketosis, but are there any steps that they could take to get themselves ready, for example?
Yeah. The first and most important thing is just trying to remove, and I say try because it does take a while, trying to remove the ultra processed foods. So just starting to look at packages and starting to look at packaging and the food that you're eating, and trying to move over to food that you recognize as food. Things that are not really in packages, things with less ingredients where possible and as budget allows, trying to remove those ultra processed foods and going back to what you and I ate when we were 5 or 6, you know, real food. That's the focus, because even by doing that, you will likely see improvements in behavior and cognition and all these things we've been talking about.
Absolutely. Ultra processed food is itself being linked more and more to mental health and metabolic ill health, specifically as a food type. So just backing away from that, it could be a preventative measure for yourself or your children. And by ultra processed food, we often mean food in a packet. So like your children's cereal, pretty much all of them will be ultra processed. Their yogurt, just taking their breakfast that they might eat for breakfast, and their spread that they might have on their their morning toast and even their toast. All of those, pretty much all standard convenient breakfast items would be ultra processed. So just by focusing on breakfast first and replacing it with an egg-based, then you're kind of already making a start on that.
Yeah, definitely. And I think I was thinking about it as you were saying it. One of the things I do with people is just start, especially the people that really don't even know how to eat properly, is just start with breakfast. And if you like bacon and eggs, or eggs and avocado, or eggs and some sort of fish like tinned fish or salmon or something, if you can have that and just have a combination of that every day in the morning, doesn't matter what the rest of the day looks like, just get started with that and that alone. And that will really help to set you up for the day.
Great tip.
Then you can start to look at the other meals. But just starting with that is a fantastic first step.
And I'm sure lots of people will want to find out more about your research. So I've got the link to that. I will put the paper in, but also to follow your work and perhaps get in touch with you for direct support. So how best should they keep in touch with you or get in touch?
Yeah, so you can find me on social media. So I'm on Instagram and Twitter and LinkedIn. You can find me just by putting my name in there, or you can find my company, which is IKRT. And maybe you can put that in the show notes for people too. So you can find me online, but also you can just go direct to my website, which is ikrt.org. It's just me there. So I'm the one at the back. There's no funny bots or other people there at all. It's just me. And you can just email me directly. You can book in a consultation call. You can have a look at the different programs that are there, and we can discuss what might be the best approach for you. And then we can go from there. But please just get in touch. Like, even if you don't really know what you want or what you need, just message. And if I can't help, then I'll point you in the direction of somebody that I think might be able to help. It's just about reaching out first of all, so that, we can get you the help that you need, or get your family member the help that you need.
That's really wonderful. Thank you for putting that out there. As a person myself with somebody in my family who has mental ill health, and this is something I want for them, but they've not taken that step. Knowing that you're so passionate about this and you're helping people, but also training people. I really appreciate you, and I appreciate you spending this time with me to explain your work, and best of luck with the next stages of that research.
Yeah, thank you so much. Thank you for giving me the opportunity to talk to your listeners and to share this.
Thank you for watching. If you like this video, please make sure to subscribe. This really helps us to be able to create more content.